Good evening, and thank you for joining us tonight for Let's Talk About It, the inaugural event from Sisters for Civics. Tonight's discussion is being presented in partnership with the Henry Clayton section of National Council of Negro Women and the Warner Robins Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I'm Lily Jackson, the Partnership and Technology Coordinator for Fair Count, a nonpartisan nonprofit that works to build long-term power in communities that have been historically undercounted in the decennial census, underrepresented at the polls, and whose communities are often torn apart in redistricting. I am also the program lead for Sisters for Civics, a coalition that is committed to ensuring that Black, Latinx, Native, and AAPI women and girls are seen and heard in our shared civic life. To start our evening, let's hear from our amazing partners.
Good evening to Sisters for Civics, Warner Robins Alumni Chapter of Delta Sigma Theta Sorority Incorporated, NCNW Henry Clayton Section, guests and friends. It gives me great pleasure to welcome you to this event, Hold the Line. I am certain that at the end of this evening, you will have received a plethora of information. Good evening. I am Dr. Gloria Dotson, President of NCNW Henry Clayton Section.
Good evening. I bring you greetings on behalf of the Warner Robins Alumni Chapter of Delta Sigma Theta Sorority Incorporated, where I serve as chapter president. We are excited to partner with Fair Count, Sisters for Civics, and the National Council of Negro Women for tonight's presentation. We are so grateful we have formed this partnership as service-focused organizations. With over 300,000 initiated members, Delta Sigma Theta Sorority Incorporated is a nonpartisan organization committed to public service in local and global communities. Our national president is Elsie Cook Holmes. The Warner Robins Alumni Chapter has over 160 members who implement programs in Houston, Blakely, and Pulaski counties. We are women ready and committed to scholarship, sisterhood, service, and social action. We understand the importance of fair districts, and despite the many challenges, our expectation is that the process would be guided by transparency, bipartisanship, and public input, since redrawing the lines can have a substantial input on our communities. There is strength in unity. Our collaboration, commitment, and fortitude will influence equitable representation and essential resources throughout our communities. Let's join forces and have a lasting impact. Thank you for participating in tonight's program.
On tonight's program, we're going to talk about the invisibility of Black, Latinx, Native, and AAPI women and girls in our civic institutions, and what we can do to make sure that we're a part of the pillars that hold up our democracy. These pillars include the census, redistricting, and so much more. We'll be answering questions, so please feel free to post them in the Facebook or YouTube comment sections, and we will get to them shortly. Our first speaker tonight is the brilliant Dr. Janine Abrams-McClain. Dr. Abrams-McClain is the president of Fair Count and an expert on the U.S. Census, among many other things. She is going to take us through how our communities have been undercounted, what that means, and what we can do about it. Dr. Abrams-McClain?
Thank you so much for that lovely introduction, Lily. And thank you so much to our partners from Delta Sigma Theta Sorority Incorporated and the National Council of Negro Women. I am just so happy and excited that we are coming together tonight for Sisters for Civics. We're going to learn some, and then we're going to keep on going on. We're going to learn about the census. We're going to talk about redistricting, and then also about and also about pandemic recovery. So I'm really excited to talk to you tonight about the census. I know a lot of you were partners with us in 2020 as we prepared for the census and really tried to make sure that Georgia had a fair and accurate count. And so recently we've received some information, some new data from the Census Bureau. And so I'm very happy to share that with you. And so if we could pull up the slides, I want to do a brief recap of what do we know about the 2020 census results and where do we go from here? Because I'll say it later, but I'll say it now, is that we have to start thinking about the 2030 census and getting ready for the 2030 census right now. Next slide, please. So I really want to do a quick refresher just about the census, the decennial census and the 2020 census in general. The census is about two things, the decennial census. It's about money and power. And when we talk about this money, we can also call them resources. So we know that based on the 2020 census, over the next decade, roughly $1.5 trillion will be allocated to communities across this country every year for the next 10 years. And so this is $1.5 trillion, and this will be allocated through more than 300 federal programs that impact education, healthcare, infrastructure, and more. And so that's the money part, the resources. We also need to think about power. How does the census impact our power as people who live in the United States? The first part is reapportionment. So when the first census numbers came out, the House of Representatives was reapportioned based on those data. So that determined how many seats each state got in Congress. It also impacts redistricting that you're going to hear from Marika about a little bit later tonight. And that is where state officials redraw boundaries, not only for political districts, but also for school zones. So that's another source of power. And then census data, the census is the basis for voting rights enforcement and civil rights legislation. And so when we think about our power, these are three things that the census touches on a regular basis. Next slide, please. So I'm going to tell you a little bit about 2020 census results that we just got. Next slide. So for the 2020 census, or based on the 2020 census, when we last year when we received the first data, the states were reapportioned. And what this graph shows you, or this figure shows you, is that some states gained a seat. So if you had population growth, you could have gained more representation in the House of Representatives. And then some states who lost population lost a seat. And so if you were, the states that are in green gained seats, and the states that are in purple lost seats, and everything in that's not colored, those are states that maintain their congressional seats. One thing that was a shocker across the nation when the data were first released was that New York State lost a congressional seat because they failed to count 89 people. So they were 89 people short of keeping their district. Nobody was expecting them to gain a seat, but no one was expecting them to lose a seat either. And had they counted just 89 more people, they would not have lost their a congressional seat. So it really does matter. When we say that every single person counts, that really matters, especially when it comes to reapportionment. Next slide, please. So let's talk about Georgia. All right. One thing we knew at the end of the census in 2020 was that Georgia exceeded the self-response rate from 2010. So we know that in 2020, Georgians showed up enough so that those who responded on their own, actually, there was a higher percentage in 2020 than there was in the previous census in 2010. Now we have some of the later numbers that came out is that Georgia's population increased by over 1 million people between 2010 and 2020. And so now the population is roughly 10.7 million people. One thing that's really cool about this, and when we think about how this state is growing and changing and becoming more diverse, is because Georgia is one of 5 states that had the largest population gains between 2010 and 2020. So that 1 million people was significant and put Georgia in the top 5 for population gains. When we look at the demographics, one thing we see, and we look at diversity, the diversity we see, if you drive around the state, you will see this diversity. Black, Hispanic, and Asian populations in the state of Georgia increased over the past decade. The white population decreased by 1%. And with these new numbers, Georgia is currently 51.9% white. And so we are seeing that the state is becoming more diverse, and that diversity is reflected in the numbers that we see in the census. Next slide, please. So a few weeks ago, this is data that a lot of people were really waiting for. It came from a survey called the Population Estimate Survey, or PES. And so this is a survey that the Census Bureau uses to figure out how well they did in counting people. And it's where we get national net undercount numbers, as well as we get omissions, which tells us how many people were missed. Next slide, please. So when we look at who was undercounted in the nation, unfortunately, what we see with the PES results is that we do see that communities or populations that have been historically undercounted in the census were also undercounted in the census again. And this was not necessarily unexpected. We did a lot of work across, in the state of Georgia. And again, this is for the nation, not for the state of Georgia. But organizations, people, advocates across the country did a massive amount of work to make sure that, or to try and ensure that this was a fair and accurate census. Unfortunately, this census was hit by challenge after challenge after challenge. And the fact that we have data that we can actually use from the census is a testament to the work that all of the folks, including some of you, did to make sure that we got a fair and accurate count. But unfortunately, because of those challenges, primarily the pandemic, but also political interference around the census, we do see that we have some significant undercounts in historically undercounted communities. So across the nation, Black people were undercounted at a rate of 3.3%. Those who identify as some other race were undercounted by 4.34%. Hispanics and Latinos were undercounted at a net rate of 4.99%, so about 5% of Hispanics and Latinos. And then the highest undercount rates were seen in American Indians and Alaska Natives who were living on reservations. And they had an undercount at a net rate of 5.64%. Next slide, please. Again, we also saw a continued trend of young children being undercounted in the census, and these are all from PES data. They were undercounted at a rate of almost 3%. And then renters, compared to homeowners, renters were, again, this is a trend that we've seen over and over, that renters were undercounted at a net rate of 1.4%. And we see this trend of homeowners being overcounted and renters being undercounted. Next slide, please. When you hear people, and we talk a lot about who is undercounted, but one of the things, or the numbers that we need to look at, is also the omission rates. So this is saying who is missed. When we talk about net undercounts, that includes the people who were missed and the people who were counted more than once. But one thing that we need to pay attention to, especially in Black and Brown communities, is we need to pay attention to the omission rates. So Black and African Americans were omitted at a rate of 10.2%. That means that 10% of Black people in this country just weren't counted. They were missed in the census. When we look at some other race, that is another 9.9%, around 10%. And then for Hispanics and Latinos, they were omitted at a rate of 10.5%. And so again, we have to pay attention to those net undercounts, but we also need to pay attention to just what percentage of our populations were just flat out missed in the census. Next slide, please. So those are the data. We have some more data that'll be coming out over the next year. We'll some more data that will be coming out as early as May. Still processing data from the 2020 census. But where do we go from here? Next slide, please. One, we need to really focus on three things: research, funding, and testing. We need to fully understand, and we need to research. And there are groups that are, advocacy groups that are already working on this. But we need to understand what causes these undercounts and overcounts. So those are both inaccuracies. If you're not counting the people, if you're undercounting people, that's a problem. But also, what is going on with the way that the census is conducted that particular groups get overcounted? And in the 2020 census, there were two groups that were, there were two racial and ethnic groups that were overcounted, and that was white population and also the Asian population. They were overcounted in the census. So what's happening that we get both these inaccuracies with people being undercounted and then people missed and people that are being counted more than once? We also have to work to get funding. The Census Bureau needs money to test new strategies that look at these inequities that we're seeing. And, we obviously need to focus on historically undercounted populations that I just mentioned, but we need to look at rural communities. We also need to look at communities and to do testing before 2030 to see what strategies work and what strategies don't work in rural communities and historically undercounted populations and in communities that are prone to disasters. I'm thinking about New Orleans or coastlines that are getting hit by tornadoes and hurricanes and out west with wildfires. The Census Bureau needs to prepare for that. Ask your dad. That was my son. He was counted in the census. All right. He's 6. Okay. So we need to really pay attention to, to get these tests, but the Census Bureau needs money to, and needs funding to be able to do these tests. Next slide, please. And then we need to focus on partnerships. That's y'all, right? We need to focus on partnerships and equity. And so we need to work with the Census Bureau. The Census Bureau has a wonderful program with national partners to keep them in the loop and to keep them, keep them updated on what the Census Bureau is doing. But we also need to make sure that we get local partners and organizations and keep them in the conversation as well. And then last, we need to focus on equity. There are a lot of calls from people to revamp or modernize the census. And a lot of that has to do with the types of data that they use and the type of strategies and operations that they use. But if equity is not at the forefront as these changes are being made, then we are going to see the same undercounts and overcounts and inaccuracies that we've seen in past censuses. And so we need to make sure that equity is at the forefront. Next slide, please. We also need to do and participate in the American Community Survey. This is known as the long form. It goes out to almost 300,000 households every month. And so we need to really focus on and pay attention to the American Community Survey and encourage those around us and in our communities to participate in the American Community Survey if and when it comes to their doors. Next slide, please. And then we got to get ready for 2030. Next slide, please. So again, we have to start preparing now. We have to learn from past challenges, prepare for new challenges. We need to look at all the data. We need to stay engaged with the Census Bureau, and we need to make sure that we are proactive, right? We need to say, hey, that didn't work the last time. Maybe we should try this. We need to make sure that we're proactive instead of reactive as changes come down the pike as we move towards 2030. Next slide. And we have to keep communities engaged. We have to remind people that the census is a key pillar of our very democracy. And we know that our democracy is under threat. So we just keep having to talk to people so that they know that the census is important. I talk about the census all the time. And people are always asking, why are you talking about it? It's over. Because it matters, and because we have to be prepared, and we have to pay attention to how those data are being used. We need to think about how they're used in our daily lives, just as well as how it impacts our democracy. Again, we need to participate in the American Community Survey and also other surveys that the Census Bureau conducts. And then last but not least, we need to keep the message going in our organizations. If we put everything down and don't talk about the census, the 2030 census until 2029, then we are going to be fighting an uphill battle. If we can just go ahead and make it a normal part of our conversations, something that people think about and apply to their daily lives, then come 2030, we'll have less of a lift and we'll be able to be more impactful on the ground. Next slide. And that's it. So thank you so much. And I think we have some time for questions.
Hi, yes. Thank you so much, Dr. Abrams-McClain, for that insightful presentation. We are going to take a question or two from the audience. Remember, you can ask your own questions in the Facebook or YouTube comment sections. We see your comments there already. So if you do have questions, then you can put them there right now. First question that we have is, for clarity, what was the undercount in Georgia?
I was muted. So we don't know what the undercount in Georgia is yet. That is data that the Census Bureau will be releasing in May of this year. And so we will get an idea. They'll tell us in Georgia and all 50 states and the territories what the net undercount was for those states. So like I said, there's more data coming out. There are lots of data products, lots of reports that come from the Census Bureau, and we just have to keep on top of that. And you can always come to Fair Count and we'll let you know exactly what that was.
Yes, faircount.org. Innocent plug. Just a follow-up. So does that also include the undercount data for people of color in my town?
No. As I mentioned, there were a lot of issues with the 2020 census, the pandemic, political interference. And so the data, while the Census Bureau says that they are fit for use, the data aren't as strong as they could be. And so one thing that we do know is that when they release information about state-based undercounts in May, that won't include any information about how many Black people were undercounted or how many Native Americans were undercounted. We're only going to get that information at the national level. And so unfortunately, we won't be able to say, in Tucker, Georgia, that the Black population was undercounted by this percent. Hopefully in the 2030 census, we'll have much better data, and then we'll be able to really drill down to see where those undercounts are happening in our communities.
That's exciting. I do hope that 2030 census includes that. It would be really interesting to see. We do have one more question, and people want to know, when can I complete the American Community Survey?
So the American Community Survey, I will say when to complete it, if it comes to your door, if and when it comes to your door. Like I said, this survey is sent to about, I think it's 295,000 households every month. And so that's this is a big country. So it's a small sample. And so it's not like the decennial census where it's like, starting on April 1st, you're going to get this and you can start taking it. There's no set deadline, but the American Community Survey, that long form, that's how we update a lot of stuff from the census. That it really impacts how funding is distributed, how resources are distributed. And so I think we need to, so the thing is, if you get it, if your neighbor's like, hey man, I got this big old thing in the mail, this long form from the census, I thought the census was over. It's probably the American Community Survey. And you need to tell them, hey, go ahead and fill that out, because that is it is critical as we move in between decennial censuses. That the American Community Survey is critical to making sure that communities get the resources that they need.
Thank you so much, Dr. Janine Abrams-McClain.
Thank you,
We
Lily.
are so thankful for your expertise here, and I'm sure the questions are going to keep coming. Everyone can go to faircount.org for updates. And thank you again so much for taking time out of your evening.
Thank y'all. Bye.
Awesome. As she said, the census is so very important. It underpins just about every aspect of our democracy, and that includes other pillars of our civic life, one of them being redistricting. Redistricting is when voting districts are drawn by population, and it's a process that's been used many times to erase the power of Black, Latinx, Native, and AAPI women and girls. Speaking to that will be Fair Count's own Marika Kilstra, our redistricting coordinator, who's been training local folks how to make their voices heard in the process and knows the issues inside and out. Certified expert. Marika, would you give our presentation? Thank you.
Thank you so much, Lily. Yeah, thank you for that wonderful introduction. My name is Marika Kilstra. I'm just going to be talking to y'all today about redistricting, about how it impacts you, and kind of how it really functions as one of the main pillars of our democracy. All right, so we're just going to go over some basics about redistricting. What is it? Why does it matter? What is gerrymandering? Where are we in the process in Georgia, and how is it impacting our communities? And I'm going to give y'all some updates on kind of the most recent things that have been going on in Georgia as well. Next slide, please. All right, so what is redistricting? So redistricting is the process of drawing boundaries for electoral and political districts in the US, and it's usually done every 10 years after the census. And the reason it's done after the census is because the census is giving us the most up-to-date information about where people are living, about these demographic shifts we've seen, about kind of how our state and our cities are looking at this point in time. And we want to make sure that at every level of government, there are about the same number of people in different districts at the same level. And that's so that, you know, one district doesn't have 100 people in it and one district has 10,000 people in it, because we want our votes to be equal the same in different districts. So, you know, populations shift and move. And so we have to redraw these lines to make sure that people's votes are ideally worth the same across districts. And the way that we do that actually determines who represents us and the resources our communities will get for the next 10 years. And it's really determining the quality of the representation we're going to be receiving. Next slide, please. All right, so here it is based on the census. Dr. Abrams-McClain gave a really incredible presentation about the census, so I think we can just skip over this. So next slide, please. But basically what that slide is saying is, you know, all the changes that Dr. Abrams-McClain discussed mean that our districts are going to have to change. Because we have so many more people living in our state, all of our districts are going to have to grow a certain amount. And some districts are going to have to grow so much that, you know, an entire county could be moved into a completely different state Senate district or state House district with a completely different representative. So it really does have these effects. All right, so what are the lines we're actually talking about here? So we're talking about redistricting any political line you can think of, from your congressional or your US House districts to your state House and Senate districts to your voter precincts. Where do you go vote? To your county commissioners, your school boards, your judicial districts, your courts. All of those are impacted by redistricting and really touch our lives at all different levels. Next slide, please. So as I've said, you know, this is basically setting the political landscape for the next 10 years. And the way that this is done actually impacts the resources our communities will get for the next 10 years. And it's going to determine whether our elected officials are fairly representing us. So if we have fair districts, if we have districts that are keeping our communities intact, that are not splitting up communities, it keeps politicians from taking power away from communities and from carving us up. And it keeps them accountable to us in the long term. Next slide, please. So gerrymandering is what happens when this process goes wrong. So basically, you can think of this as politicians trying to rig the game in order to get the results that they want. So they know, okay, we're drawing district boundaries, and they decide they're going to draw boundaries in a way that's going to favor their party, it's going to favor a certain group, or it's going to favor incumbents, people who are already elected. And so basically, they're just trying to make districts as non-competitive as possible, or draw them in a way so that they're choosing their voters. We're not choosing our elected officials. And the way that what this does is it has really negative impacts on our democracy and on our representation as communities. Next slide, please. So this is obviously not something we want. Communities who have been gerrymandered, who have been, politically manipulated in this way, lose political power and access to resources. And what is done in gerrymandering is that politicians are making districts less competitive, which means that our elected officials are really going to be less responsive to us as their constituents. They know that they're going to win regardless. So what is the purpose of them having to actually listen to people? And it really does. And it also means they really don't have to compromise with people outside their base. Again, because, it's a less competitive district. They know they're going to win. Really, the only threat to them and them holding on to power is someone more extreme within their own party challenging them. So we've seen this has actually been tied to kind of greater polarization across the United States, and has had really negative impacts on our democracy. And one other thing I'll say is that gerrymandering has really been used to target communities of color, and specifically Black communities across the US throughout history. Next slide, please. So I'm not going to go into kind of, the nuts and bolts as much of how this actually happens. Basically, what you'd need to know is that it's politicians taking advantage of this, trying to manipulate the redistricting process to benefit themselves. But I will give you this one example, which kind of speaks to how this can take away people's power. And so this is called prison mandering. It's when in some states, the census is counting incarcerated people as residents of where they are incarcerated and not as residents of their home address. And this is really distorting representation at state and local levels. So as we know, Black and Brown communities are disproportionately targeted by the police and incarcerated at really disproportionate rates. And in Georgia and in a lot of states, prisons are often located in rural white areas, which means that the voting power of rural white folks in those areas with prisons is inflated, while the voting power of Black and Brown Georgians is diluted. And so this is a widespread problem. Only 11 states have actually banned prison mandering so far. There are some things that counties and cities can do to choose not to engage in this process. And there's an example from Illinois, where 60% of Illinois' prisoners are from Cook County, but 99% of them are counted outside the county. And so this is just an example of how we're drawing these districts, how we're counting people in the census, and where they're being counted has a real direct impact on representation, especially for communities of color. Next slide, please. All right, so where are we in this process? So we are coming kind of at the tail end of this process now, at least for this most recent round of redistricting. This is just kind of a general timeline. Last year, over the summer, the state legislature held a redistricting summer town hall series. That was actually before any census data had been released that could be used to really dig into, how we want the districts drawn. So it was limited in a lot of ways, but it did give people an opportunity to speak about what they wanted. August, the Census Bureau released census data to be used in redistricting. November, Georgia's legislature held a special legislative session to draw and pass maps for state House, Senate, and Congressional districts. Those have all been passed and signed into law by the governor. But now the regular legislative session is happening currently. We're almost at the very end of it. But local maps for Board of Education districts, your Board of Commissioner districts, and more at these local levels are being drawn right now during the regular legislative session. So there is still time to get involved in this process, and it's always important to follow what's going on. This is something that does, impact our lives for the next decade. Next slide, please. All right, so local redistricting. This is what's happening right now. Those lines are your school board districts, your county commissioner districts, and more. And these often have a much stronger impact on our our day-to-day lives. Your school board determines what's taught in your schools, how are kids, how are your schools responding to COVID, all those things. Your county commissioners are deciding how is money spent in your county. So these really local level stuff, these lines are being drawn right now, and they can often have a lot bigger impact on our lives. So the way that this is done in Georgia actually varies county to county. It's very difficult to, it's not kind of a one size fits all thing. So it's extremely important for people on the ground to be as involved as possible in the local process. And what that means is directly reaching out to your elected officials, directly contacting your county commissioners, your school board members, and asking them, what are you doing for redistricting? How does this look? Are there any ways for public input? I want to make sure that my community isn't split up and that we are fairly represented. So it's really important to reach out directly to people on this, and I'll get into that in a second. All right, next slide. So what have we been doing around redistricting? So we've been working about over the past year and a half mostly on educating people about redistricting, on getting folks to draw community maps, and generally on testifying and just sharing information with the community about what's going on. So we've completed 114 trainings with community partners to teach people about redistricting, just like this one. We've partnered with Delta Sigma Theta sorority on a 12-part redistricting training series to train up members and draw community maps. We're incredibly grateful for that partnership. And through that, we've taught people to make community maps. And that was part of us gathering more than 400 community maps, showing how people want to see their communities represented. So that's really just people being able to speak about how they want their community represented in redistricting. And being able to give that to the legislature. We've also just generally shared information with the community and testified. And I would definitely recommend following Fair Count on social media if this is something you want to continue learning about and stay informed about. Next slide, please. So what can you do to get involved? So there's still some things you can do. We are kind of at the end of this process, at least for this session. You can still draw a map of your community at representable.org/drive/faircount. That's a great way of showing what you want to see and making sure your community isn't split up and have your power taken away in that way. You can write a letter to the editor of your local newspaper. You can contact your local elected officials about the process. You can talk to your friends and family about redistricting. And follow us on social media and find further events at mobilize.us/faircount. Next slide, please. So just to kind of close us out with, what has been the most recent things happening in Georgia around redistricting. Just again, local redistricting is happening right now. The regular legislative session is scheduled to end on this coming Monday, so it is really coming to a close. There are still multiple lawsuits pending that are challenging the validity of Georgia's new districts at multiple levels. So a federal judge has ruled that those will not overturn their new districts for this year, for the elections that are happening this year, but it could possibly change districts up in the next few years. So that's something to kind of stay aware of. And it's really extremely important to stay involved and stay informed as much as you can. This is a process that has really been hidden intentionally from people. It's something that has a huge impact on our lives, and that has really been not transparent in a lot of ways and has really been weaponized against communities of color and specifically Black communities in the past. So it's really important to do everything you can to follow this process, to make sure, to speak up as much as you can. And if you have any questions, please feel free to reach out to me. Next slide, please. All right, well, does anyone have any questions for me?
Yes, we do have questions. So thankful for you and for your presentation. You're really able to break this entire situation down into terms that we can understand. So really thankful for you. As you said, many of the pillars, that hold up our democracy can be complicated, sometimes by design. So we're going to answer some of these questions. And remember, those of y'all tuning in, drop your questions in the Facebook or the YouTube comment section. So one of the questions that we have is, you mentioned drawing a map of our communities.
Mhm.
How do you do that and why? Like, where do the maps go?
Yeah, that's a really good question. So we've been using this program called Representable to ask folks to draw maps of their community. That's literally just drawing a map. You answer a few questions about, what is your community like? What are some main meeting places? Kind of just to give an idea of what your community is. And then you draw it physically on a map using something really similar to Google Maps. And the reason it takes less than 15 minutes, it's really easy. And it's a really incredible way of actually being able to speak and kind of give this very physical form of testimony to people who are drawing maps or to people who are analyzing maps in the future. So our maps are set in a lot of ways for, kind of this state level stuff, but there are still lawsuits out there. And sometimes lawsuits do pull from community testimony or things like that. Like if you drew a map of your community and the state Senate map split it right down the middle, and there was a bunch of other people who showed that as well, then your community could take that into account when they're, redrawing them in the future. So it's all going into a database that's public, that up for fair count, it's public for everybody of all these maps. And it's basically, a place for all this testimony to be. We've shared it with the legislature. It's public information for if there are these lawsuits in the future and for kind of analyzing existing maps to make sure they're fair.
That's awesome. I actually have done that map, and it is a very simple process, very informative. It really makes you think about community in a way that we haven't in a long time. So yes, y'all should definitely make a map. Another question that we have. So if this happens once every 10 years, how do we stay involved in between these redistricting cycles?
Yeah, that's a good question. Yeah, I mean, I think, this is something that the big scale redistricting happens once every 10 years. And that is kind of the reality. But there are these things that are happening in between. There's these lawsuits that are pending. There's possible, lower, your city level redistricting, stuff like that. That is happening more frequently than that you can just stay engaged with. I think it's also important to talk to people in between those 10 years, because what happens is that it's something that happens every 10 years. People don't know about it. People forget about it. And then it kind of sneaks up on people. And then it's used as a way of taking power away from people and kind of in this very hidden way. And so I think if you can have conversations with your friends, with your family about it, if you can try and stay engaged and stay aware of, these lawsuits, of what's going on with districts, then I think that in itself is extremely valuable. So kind of just trying to stay up to date on what's happening, really reaching out to your elected officials and staying, involved with what's going on there, and being ready for the next round as well.
That's awesome and very important on how we stay engaged, not only for redistricting, but for the census as well. These 10-year your gaps, your representatives change, you might move, your community might change a lot. So thank you again so much for your presentation and for sharing your evening with us.
Yeah, thank you.
Have a good one. So y'all, finally, there are real consequences when we are unseen and undercounted, including getting underserved in times of crisis. To close out, we'll discuss how COVID-19 has affected our communities with Sabrina S. Thomas, Senior Infection Control Coordinator and Public Health Specialist. Over to you, Sabrina.
Hi, thank you so much for inviting me. I'm very privileged to be here this evening. Have you ready to pull up the presentation? Great. Next slide. I have no financial disclosure or conflicts of interest related to this information. Next slide. I want to just go over these topics throughout this presentation. I'd like to start off with some definitions of some terms relating to infectious diseases that you may have heard in the media, give a brief overview of COVID-19, discuss disparities among African Americans, factors influencing those disparities, how to address COVID-19 disparities among African Americans, and provide the latest COVID-19 safety updates, as well as ways to stay healthy. Next slide. So you may have heard these terms in the media, epidemic. Basically, that's when you have a rapid increase in the number of cases of a particular disease that's above what is normally expected for that particular population. An outbreak carries that same definition of an epidemic, but it's used for a more limited geographical area. A pandemic refers to a global epidemic, or one that has spread over several countries and affects lots of people. Next slide. So as of March 11th of 2020, the World Health Organization declared COVID-19 a global pandemic. And this pandemic has been very unique. Not only has it caused significant morbidity and mortality, but it has really changed the way we went about our daily lives. Next slide. So in order for us to understand the impact of this virus, it's very important to review the basics. Next slide. So COVID-19 is caused by the SARS-CoV-2 virus, which is basically part of a large group of viruses known as coronaviruses. And these viruses can cause illnesses in humans as well as animals. But coronaviruses are not new. They have been circulating in the community in the United States for many years, typically causing upper respiratory signs and symptoms such as a cough or runny nose. But there are some types of coronaviruses that have caused more severe illness, such as SARS and MERS. Now, the SARS-CoV-2 virus that causes COVID-19, it is considered a new type or novel type of coronavirus. And the one thing that stands out about new viruses, as they persist throughout a community, they have a tendency to change in various ways, have small differences that may affect the way it's spread, that may affect how it responds to treatment and vaccinations. And those are known as variants. Variants can sometimes appear in a population or for a brief amount of time, or sometimes it can disappear or persist. To date, the two variants that have caused significant health impacts was the Delta and the Omicron. But the good news as it relates to responding to variant is that being up to date with your COVID-19 vaccination will really help reduce the spread of viruses and help prevent new variants from emerging. So that's why having a high vaccination coverage in a population is very key. Next slide. So COVID-19 has signs and symptoms that are kind of similar to that of influenza, the flu. But the one sign that particularly stands out or is more frequently seen with COVID-19 is that of a new loss of taste or smell. Now, the incubation period, meaning from the time of exposure to the time that symptoms appear, is generally between 2 to 14 days, with the average incubation period being about 5 days for COVID-19. Next slide. It's generally spread the same way as with flu and other respiratory viruses. When respiratory droplets are expelled, when an infected person coughs or sneezes, and those infected droplets can land into the mouth or nose of people who are nearby or possibly inhale into the lungs. They can also be spread between people who are within close contact with one another, within 6 feet. And close contact, according to CDC guidance, is within that 6 feet. And then you have that time frame of at least 15 minutes or more cumulative over a 24-hour period. Anyone with COVID-19 can spread it, even if they do not have symptoms. So you do not have to be having symptoms in order to spread it. You can be asymptomatic or without symptoms, and you can still spread COVID-19. So that's very key to know regarding its spread. Next slide. So this table pretty much shows the total number of COVID-19 cases that we have seen since the start of this pandemic. In the United States, we have seen over 79 million total cases, and we've seen over 960,000 total deaths. Here in the state of Georgia, we have seen over 2 million cases and over 36,000 deaths. And this is data that is current as of March 19th of this year. But this only shows a snapshot of this pandemic, because there have been racial and ethnic minorities who have been disproportionately impacted by this pandemic. Next slide. So during the time period, March 1st of 2020 through February the 19th of 2022, this slide shows that non-Hispanic Blacks had the second highest COVID-19 associated hospitalization rates. And as you can see here, compared to non-Hispanic whites, non-Hispanic Blacks had much higher hospitalization rates. Next slide. Here in Georgia, during the beginning of the pandemic in the Atlanta area, Black patients with COVID-19 were more likely to be hospitalized than white patients, with 79% and 13% comparing. Next slide. So recently, CDC noted back in a report on March 18th of this year that hospitalization rates were highest among non-Hispanic Black adults and nearly 4 times as high among Black adults than whites during the peak of the Omicron variant. There have been many disparities as it relates to COVID-19 mortality between African Americans and whites throughout the United States since April 2020. Approximately 97.9 out of every 100,000 African Americans have died from COVID-19. This is a mortality rate that is a third higher than that for Latinos and more than double that for whites as well as Asians. Next slide. So in order to determine what are these factors influencing these disparities, it's really important that we look at the social determinants of health. Next slide. And the social determinants of health are those conditions in the places where people live, learn, work, play, and worship that can have an effect on their health risks as well as their outcomes. For example, with discrimination still existing in many systems affecting healthcare, housing, criminal justice system, education, and finances, which can lead to chronic toxic stress, as well as mistrust in governmental programs and healthcare initiatives. There's still some segment of the African American community that remember the Tuskegee experiment, when African American men who had syphilis were allowed to go untreated just so the effects of the illness can be studied in them, and no informed consent was attained. So to this day, there's still mistrust from that as it relates to vaccines and any other kind of health program initiatives. Healthcare access and use, lack of health insurance. There was a study done by the Kaiser Family Foundation in 2018, and it noted that 11.7% of African Americans in the United States lack health insurance compared to 7.5% of whites. Studies have shown that those who do not have health insurance are more likely to forego necessary medical visits for treatment, for testing, medication services, compared to those who have insurance due to concerns of cost. And then there's transportation issues, childcare, inability to take time off of work in order to seek health care. And then regarding occupations, many racial and ethnic minority groups are more likely to work in those service industry fields where they have to have face-to-face contact with others. And so during the pandemic, there were some employers who didn't even allow their staff to take paid sick time off unless they had a positive COVID-19 test result. But knowing what we know about the spread of this virus, by the time that employee received a positive result, they had already infected their close employees. And then educational income and wealth gaps, limited job opportunities, inability to look for or have the ability to have a higher paying job, a job that offers health insurance or better sick time leave. And then there's, of course, issues with housings. Most racial ethnic minority groups live in those multi-generational homes where it's difficult to separate when ill or sick. Next slide. Throughout this pandemic, we have seen many societal, psychological, and technological impacts, but there have been some segments of the populations who were able to have some positive experiences during this pandemic. There have been people who were able to have career change, go into entrepreneurship. There were individuals who were able to refinance their home loans or purchase a home for the first time due to low mortgage rates. Then there was virtual networking. There were employers who were able to allow their employees to work from home due to the use of Zoom or Teams. Faith-based organization. Churches were able to modify their in-person services to online. And then, of course, there was social entertainment available online. But unfortunately, the disadvantages were a lot and very impactful. was social isolations. Family and friends, people weren't able to visit them when they were sick, loved ones in nursing homes, so you could only do window visitations, unable to have a proper wedding or even a funeral, job loss of companies, shutdowns, restaurants had to close, people lost their wages, and then people became caregivers. They had to stay home to care for their loved ones. And then during the time of the pandemic, we had school closures and parents had to homeschool their children. But unfortunately, there were some communities that did not have access to Wi-Fi and internet. So these disadvantages really had a significant impact among racial and ethnic minority groups. Next slide. So as it relates to comorbidities and risk conditions, people in racial ethnic minority groups are often younger when they develop a chronic medical condition, and they are more likely to have more than one chronic medical condition. And the risk of severe illness with COVID-19 tend to increase when you have more than one comorbidity or chronic medical condition. I've seen this firsthand in my role in healthcare during the times that I reviewed case reports from COVID-19. Majority of those cases were among African Americans. Their comorbidities included obesity, type 2 diabetes, and cardiovascular illness. And also there were psychological issues too that play a role. Next slide. So regarding myths and disbeliefs, as I said in the previous slide regarding discrimination, there are still some segments of the African-American communities as well as other racial ethnic minority groups that just do not trust, governmental programs or healthcare initiatives, and just have still to this day myths and disbeliefs regarding the COVID-19 vaccines. One particular myth, a COVID-19 vaccine can make me sick with COVID-19. COVID-19 vaccines can alter my DNA. COVID-19 vaccines contain microchips. And unfortunately, these myths and disbeliefs can be communicated throughout these communities and really have an impact on the uptake of vaccinations among these population groups. Next slide. So how do we address the COVID-19 disparities among African Americans and other racial minority groups? Well, it's very important that you address their community concerns, address the information in a clear and easy to read manner. CDC has a community-based organization, COVID-19 vaccine toolkit, that will allow public health leaders and governmental officials to use that to provide some great education materials to their community partners. Partner with trusted messengers, faith-based leaders, nurses, doctors, someone where the people in the population will be able to trust and believe that they're giving factual information. Develop culturally relevant materials, utilizing the language that's predominantly spoken in that community and that a tone that they accept. Reach out to local public health departments regarding community testing and vaccination sites. Studies have shown that counties that have a travel time of 20 minutes or more from a COVID-19 vaccination testing site, COVID-19 testing site, are more likely to be made up of racial ethnic minority groups, made up of those who are uninsured, as well as made up of those in the rural communities. So it's very important to reach out to those public health departments regarding a mobile community testing unit or mobile vaccination unit. And then connecting with community partners in order to meet the physical, spiritual, and mental health needs of community members. It's very hard for a person to think about getting a COVID-19 vaccines when they do not know when their next healthy meal will come from, or they have unstable housing. Next slide. So here is some updated information from the CDC as relates to vaccines. And actually, we have some news that's hot off the press as of today, March 29th. CDC has actually updated their recommendations for those who are immunocompromised and those who are over the age of 50 years that after they receive their initial booster dose, when it's been 4 months or more, they are eligible to receive another booster dose with either a Pfizer or Mandarin vaccine. And they did this in order to provide or to help them to provide better protection from severe illness of COVID-19. So that is currently new and posted on the CDC website. But fully vaccinated at this time means that a person has received all the recommended doses in their primary series as it relates to COVID-19. Basically, that means that that individual received 2 doses of either their Pfizer or Moderna vaccines or 1 dose of their Johnson & Johnson vaccine, and 2 weeks has passed after the end of those final dose for the respective vaccine. Up to date means the person not only have received all their recommended doses in their primary COVID-19 vaccines, but they also receive a booster dose when eligible. Now, according to some information that was made available earlier in March, here in the United States, approximately about 50% of the U.S. population is considered to be up to date with their COVID-19 vaccines. Here in the state of Georgia, it's considered to be about 40%. The population is 40% up to date with their COVID-19 vaccines. Unfortunately, African Americans here in the state of Georgia have been found to be having the lowest percentage of being up to date. And the goal is for everyone to be up to date with the COVID-19 vaccine because it has shown through various studies that it had a significant reduction from severe illness from COVID-19, from hospitalization, as well as death. It can also help with the protection of emerging variants. And you can see here, CDC recommends that everyone ages 5 years and older get their primary series COVID-19 vaccine, and everyone ages 12 years and older receive a booster shot. Next slide. CDC also updated its guidance regarding quarantine and isolation. And basically, quarantine means that you separate yourself from others when you've been exposed to someone with COVID-19, but you're not having symptoms. Isolation means that you separate yourself when you're sick with COVID-19 from others. So what they did, they shortened the isolation period for those who are asymptomatic, meaning they're not having any signs or symptoms, and those who just having a mild presentation of the illness, as well as the quarantine period to 5 days. This decrease was basically done to focus on the period when a person is most infectious. And once this period is met, it's followed by continued masking for the additional 5 days. Now, if an individual is having severe illness with COVID-19, or if they're considered to be immunocompromised, then they should discuss with their healthcare provider when they should end their respective isolation period. And isolation should only end if a person is fever-free for at least 24 hours without taking any fever reduction medications and other symptoms have resolved. CDC also provided another update regarding quarantine by saying that if you've been up to date with your COVID-19 vaccines, or if you have had COVID-19 in the previous 90 days, you do not have to quarantine. So that's another advantage of being up to date with your vaccinations. Next slide. On the Georgia Department of Public Health website, they have an isolation and quarantine calculator. And basically, when you go into this website, you can enter the information that is relevant to you. So if you're symptomatic, you enter the first day of your symptoms. If you have been tested positive or you're not having any symptoms, then you enter the date of your positive test date. If you're exposed to someone with COVID-19 and you have not receive all your recommended vaccinations for COVID-19, then you would enter the date of the last contact with that person who tested positive. And then that calculator will give you your respective quarantine or isolation period. Next slide. So CDC has also provided some updated guidance as relates to masking. And this guidance is based on COVID-19 community levels. This is the link that you can go to. And basically, the community level is to really check the community status of COVID-19 in your respective county. And it really takes a look at the impact of COVID-19 on hospitalization, as well as the healthcare strain for your particular county. This information is updated on a weekly basis, Thursdays during the evening time. Next slide. So I hope you can see here that when you enter in your respective county, if your county comes up to be at a low community level, basically it's saying that your public health intervention or guidance is to stay up to date with your COVID-19 vaccines and get tested if you have any symptoms. If your community level comes up to be a medium, and if you're considered to be at high risk for COVID-19, high risk for severe illness of COVID-19, then you should talk to your healthcare provider about whether or not you should wear a mask and what other prevention measures you should take. If your community level is a high, it is recommended that you wear a mask indoors in public, and of course, stay up to date with your COVID-19 vaccines, get tested if you have any symptoms, and discuss with your healthcare provider about any other additional precautions you should take. But overall, a person can wear a mask at any time. The key thing about a mask, you want to make sure that it is well fitted. People with symptoms of COVID-19, had a positive test within the past 10 days, or been exposed to someone with COVID-19 should wear a mask according to CDC guidance. And masks are still required on public transportations. Next slide. So in order to prevent the spread of COVID-19, it's very important that we take the necessary steps to stay healthy. Next slide. So it's very important that we stay up to date on our recommended vaccines according to our age groups and according to our health status and according to the immunization schedule that is posted on the CDC website. You can stay up to date with your annual flu vaccines. We are not in a flu pandemic, but we are in flu season. Flu season typically starts around October and can last as late as May. African Americans, unfortunately, since this past 10 flu seasons, had a high hospitalization rate from flu complications. So it's very important that this population stay up to date with the flu vaccines, which includes 6 months of age or older. And then stay up to date with your pneumococcal vaccines. This goes back to the previous slide what I mentioned about comorbilities and doing everything that you can to try to reduce that risk of severe illness from COVID-19. CDC recommends pneumococcal vaccination for all children younger than 2 years of age and all adults 65 years or older. And of course, you can stay up to date with your COVID-19 vaccinations. And then making sure that you wear a mask indoors if your COVID-19 community level is considered to be high. Avoid crowds and poorly ventilated spaces. Make sure that you test to prevent spread to others when you're having symptoms or when you've been exposed. And then wash your hands often. When it comes to hand washing with soap and water, make sure you use the time frame of at least 20 seconds. You can sing the happy birthday song twice to make sure that you're reaching those 20 seconds. And then once you finish washing your hands, use a paper towel to turn off that faucet so you don't infect yourself with any more germs. And then if soap and water is not available, then you can use the alcohol hand sanitizer, but just making sure that it has the alcohol content of at least 60%. Next slide. So here is a slide regarding some available resources as relates to COVID-19 vaccines or boosters. You can go to vaccines.gov and you could just search for nearby COVID-19 vaccines or boosters in your areas. You could also check with your doctor, your local community health center. You also check your local pharmacy's websites for available vaccination appointments. And then you also check with your local health department too. And this also plays the part for flu vaccines, for pneumococcal vaccines, and any other recommended vaccines that you should receive. Okay, next slide. And that's it. Any questions?
Yes, we do. Thank you so much, Sabrina, for presenting all of that amazing information. There's so much misinformation out there, so it's great to have accurate information presented in front of us. So thank you so much. We do have a couple of clarifying questions for you. So one is, what are your thoughts or recommendations on the second booster shot?
Well, as I stated before, for the second booster shot right now, the latest guidance from the CDC is recommended for those who are immunocompromised or who are over the age of 50 years. And it's really based on the age of the patient as well as any other health risks that they have going on. I believe starting next week, CDC and other public health agencies will be looking at offering second boosters for the population to see whether or not that would be a recommendation from that. But it really all depends on the health status and the age of the individual.
Thank you so much for that. And just making it clear, we have those questions coming in. So thank you. One more is that, what do we know about long COVID? And are there, and you did touch on this, but just to retouch, are there racially based health disparities?
Yeah, so with as I said before, with racial ethnic minority groups, they tend to have a greater risk of having more than one chronic medical conditions. And of course, the more chronic medical conditions you have, that could really play a part in increasing your risk for severe illness for COVID-19 or even hospitalization. Regarding the long-standing COVID symptoms, studies have shown that with boosting, that it kind of helped with those, decrease those presentations and so forth. Because so far, the presentation of those have been mild symptoms. So it's very important to stay up to date with your vaccines.
Thank you again so much, Sabrina, for your time this evening. And we're going to continue with the show. Thank you.
Thank you.
We have had some amazing presentations this evening with thoughtful answers to questions that we've been receiving. We will now hear from Ms. Brenda Winston with the National Council of Negro Women for our call to action. Brenda?
Thank you so much, Lily. And thank you, everyone, for joining us. This was such an impactful event. And we want to thank all of our viewers. We want to thank our partners, Fair Count. We want to also thank Sisters for Civics. And of course, the Warner Robins chapter of Delta Sigma Theta Sorority Incorporated. We are the Henry Clayton section of the National Council of Negro Women, and we were so happy to bring this webinar to you, basically to remind you to hold the line. Tonight, we heard about the census. We've learned a lot tonight about how the census affects our power, the importance of building partners. Participate, if you can, in the American Community Survey. Prepare right now for the 2030 census by keeping the census conversation going, because the census means money and power for our community. In reference to redistricting, tonight we heard about state, county, and local district lines are drawn after the census count. So that's why it's important that we are counted, right? You can lose your political power. How? When politicians draw district lines that allow them to pick their voters rather than allowing their voters to pick them. So it's important that we follow the redistricting process, as it impacts all of us, and it allows us to keep our representatives accountable. Most of all, remain involved beyond the census and stay connected to ensure our political power isn't taken away. And lastly, we heard about one of the worst pandemics in our lifetime, COVID-19, and how it has disproportionately affected our community. The numbers of hospitalization and death was way higher in our community than in other communities. And you wonder why. Why is this? We know it's because of mistrust, a lot of times because of lack of insurance. Many of us work in the service industry, unable to get, that time off, education, income, and of course, it comes back to economics, the wealth gap. But you can always stay alert by going on the CDC website. And we heard from Sister Sabrina about the toolkit that the CDC has on their website that's made available to us with the most updated information. And she urged us to connect with partners and remain engaged, because Lily, our moderator tonight, told us emphatically there are consequences when we remain unseen and undercounted. So our call to action tonight is to remain connected, stay engaged, and remember, when we do those things, good health wins and we win. Thank you so much. Lily, back to you.
Thank you, Brenda. It is always a pleasure working with you. This has been a great evening of information and conversation, and I hope it's provided perspective we can all use to stay engaged and make decisions that are best for our communities. Big thank you to all of our speakers tonight for their insight, and for the viewers and for your questions. Please remember that the May 24th primary election is 8 weeks from tonight, and now is the time to start making a plan to vote. We've shown our power before. Now we need to show we're here to stay. Visit your Georgia My Voter page tonight and make sure that you are, that you are registered. And if your plan to vote includes voting by mail, then the absentee ballot request period is now open. To learn more about Sisters for Civics, visit us at sistersforcivics.org. And on behalf of Sisters for Civics, Fair Count, the Henry Clayton section of the National Council of Negro Women, and the Warner Robins Alumni Chapter of Delta Sigma Theta Sorority Incorporated, this is Lily Jackson saying goodnight, and thank you again for joining us.